Is your dog limping? If left untreated, it could create long-term mobility and quality of life problems for your dog. In this video, we will discuss and share with you what to expect when your dog needs cranial cruciate ligament care to include surgical and non-surgical treatment options. This is Gia. She is a 5-year-old Lab and Jack Russell mix, and she has been having trouble with her right hind leg. She had surgery, and we will walk you through how it was determined that she needed it, and how her humans are helping her to recover. Stay tuned to the end of this video, because there's a lot of useful information, and most importantly, because your dogs want you to. If you have noticed your dog limping or holding her leg up for an extended period of time, there's a good chance she has a CCL tear or something else that needs to be diagnosed. In Gia's case, she was limping inconsistently for 3 months before she had surgery. At first, her humans took her to her general practitioner veterinarian who prescribed a series of 8 Adequan shots and Galliprant for pain and inflammation. Since that did not fix the issue, probably because her CCL was completely detached, surgery was her best option. After exhausting the non-surgical procedures, they consulted an orthopedic vet. He did an examination, this time including an X-ray and lab work to make sure she was suitable for the procedure. Her initial exam was on a Tuesday, and they scheduled her for surgery the following Monday. Her humans, Heather and Todd, were sent home with instructions to not feed her after midnight the day before surgery because she would turn into a gremlin. Additionally, they were advised to give her half of a meripatant citrate tablets pill to help with nausea after anesthesia. On the day of the surgery, she was dropped off. Of course, there were some papers to sign. The question that hit Heather the hardest was, if she stops breathing, should CPR be administered? Of course it should. Heather was texted at about 10 o'clock in the morning that her surgery started and was finished by about noon. Heather was able to visit with her after 3 o'clock when the anesthesia wore off somewhat. While her surgery is complete, and she came through it like a champ, there are still several weeks of recovery. Gia came home with a regimen of rest, passive range of motion exercises, antibiotics to prevent infection, and several medications for pain and inflammation. For the first several days, Heather and Todd will help her with some passive range of motion exercises, ice and massage. She will eventually also be treated with warm compresses to help blood flow. Since Gia is by nature an extremely active dog, Heather and Todd plan to keep her mind busy with low-effort training games. As always, she will get pets, cuddles, and even more attention than usual. They bought her 2 puzzle games that will encourage her to use more of her brain and less of her brawn. She will also get frozen Kongs or treat-filled toys. These provide long-lasting entertainment and a little mental workout to boot. While keeping her canine siblings at bay, Gia will be encouraged to do activities that don't involve licking her wounds or engaging in other potentially dangerous activities. Heather and Todd will become infection prevention warriors. This means being vigilant and proactive in your care. This starts with keeping her from licking her wound. The vet sent her home with an obnoxiously large e-collar. That made it extremely difficult for Gia to eat and move. They bought her this donut, which is more comfortable and actually stays in place. They will also check the incision site at least twice daily while they are icing the area. They will be looking for any redness, swelling, discharge, or anything that just doesn't seem right. These are all potential signs that something might be going wrong. Of course, if they see anything that looks suspicious, they will take pictures and send it to the vet and then follow up with a phone call. Some additional signs of infection would be unusual lethargy, lack of an appetite, vomiting, and other unusual behaviors. If there is an infection, of course, the quicker they catch it, the better it is for everyone. As far as keeping up with her medications, the vet's office gave them a template for a chart that they use to make sure that everything is given at the right time. This will ensure that she gets what she needs and that nobody accidentally gives her too many doses. If your dog is recovering from surgery, this is an excellent way to make sure everyone is on the same page. In addition to Gia, there are 2 other dogs in the house. Buddy is a docile older guy who, for the most, sniffs Gia but doesn't engage in rough play. Ripley, on the other hand, her sister and best friend, plays rough. They play tug of war. Ripley likes to chew on her neck in a playful way, and they sometimes play fight. But on rare occasions, it has become a real fight. Since Ripley plays kind of rough, Heather and Todd will separate them while Gia is recovering. This gives her space to heal and prevents any roughhousing that could jeopardize their recovery. When they are reintroduced, it will be done gradually and under close supervision. If this is the case in your household, initial interactions should be short and sweet, and always prioritize your recovering dog's comfort. Surgery is a big deal, and those follow-up appointments with your vet are crucial for monitoring your dog's progress. The vet will assess how the incision is healing, check for any signs of complications, and adjust medications as needed. GIA's physical therapy will be done at home. However, depending on the severity of your dog's CCL tear, your vet might recommend a physical therapist. This can be a game changer in terms of regaining strength, flexibility, and range of motion. Remember, a gradual return to activity is key. Don't rush the process. Your vet will give you the green light when it's safe for your dog to resume their normal activities. We are still in the very beginning stages of GIA's recovery. If your dog is going through the same thing, you should know CCL surgery is usually very successful, but it's important to be aware of potential long-term changes. Some dogs might develop arthritis in the affected joint down the road, even with surgery. This is where those joint supplements your vet recommended come in. Keep an eye out for any changes in your dog's gait, mobility, or energy levels. Early detection is key to managing any potential issues. And remember, your dog might not be able to be the same high-flying athlete they were before their CCL tear. That's okay. Adjust your expectations and activities accordingly, and focus on providing them with a happy, fulfilling life. By following this checklist, you'll be well prepared to support your dog through their CCL surgery recovery. Your dog is looking to you for guidance, comfort, and a whole lot of love during this time. Don't underestimate the power of gentle touch, a soothing voice, and simply being present with them. This is a journey you'll go through together, and with the right care and attention, your dog will be back to their old selves in no time. You've got this. Thank you for watching, and we wish your furry friend a smooth and speedy recovery. If this information was helpful, please like, subscribe, and share with anyone whose pet may be dealing with a CCL tear.